Hi, and welcome to the Under 5 Minute Explanation. I'm Nurse Tanya, and I'm going to talk to you today about the management and treatments for lymphedema. So let's get started. Why treat lymphedema? Well, treatments will lower the risk of infection, make movement easier and more comfortable, and improve your well-being. So, how does it do this? Well, treatments improve the flow of lymph and work on maintaining skin integrity. By doing this, it will help reduce swelling and improve the health of the swollen tissue. I completely understand. I don't want lymphedema and don't want treatment. Well, it's your choice. All treatments are your choice, your decision, and it's your life. But remember, if it's left untreated, lymphedema can worsen and cause severe swelling and permanent changes to the tissues under the skin, such as thickening and scarring. This will lead to poor mobility, decreased movement, increased discomfort, and recurrent infections, which will lead to more hospital stays. Okay, let's start talking about management and treatments. And I'll start with self care. You need to look after yourself. Do not wear tight and constricting clothing, shoes, bands, or jewelry. This will continue to block off the lymphatic system. Never get your blood pressure taken on the infected arm. This can cause further damage. Do not get any tattoos on the affected limb and treat any wounds immediately. This is just to prevent any infections from happening. Moisturize regularly and avoid stress. Maybe you want to add some meditation or some mindfulness to your daily routine. Light exercise encourages more lymph movement. Wrapping your arm or leg, bandaging the entire limb encourages the lymph fluid to flow back towards the trunk of the body. Needs to be done by a trained therapist or specialist or a nurse. And there is massage, a special technique called manual lymph drainage or MLD. This is done by a specialist and they can also teach you how to do it as well. But wait, there's more you can do to help improve your well-being, your movement, and your life. Compression garments are made to fit all shapes and sizes and all types of lymphedema. These garments are made to compress the affected area and encourage the flow of lymph fluid out of the affected limb. Ensure you seek professional fitter to get the correct fit. Some people may need a custom made garment. As you can see, you can get bras that support the lymph fluid post breast cancer, arm sleeves, wraps, which are called Pharaoh wraps, neck and face wraps, fingers and toes, knee highs, and thigh highs. See from this photo is a custom made. It has a silicone around the top to hold them up. Also, with professional fitting, they will be able to fit you and suit your needs. Most states in Australia now have a lymphedema subsidy scheme in place to help pay for these garments. Some people prefer to use the pneumatic compression. They'll use this once or twice a day for about an hour at a time. It is a sleeve that is worn over your arm or leg and connects to a pump that inflates intermittently, putting pressure on your limb and moving lymph fluid away from your fingers or toes. These can be quite expensive, but you can also hire them in most states. Another therapy is laser therapy, which is done by a professional. Laser therapy uses a low level laser to target cells in the lymphatic system. This can help with any thickening of the skin and pain by reducing the volume of the lymph fluid in the affected area. Some people prefer to use lymph taping, which is applied by a lymphedema therapist. It is different than normal strapping and it has been shown to help the lymph fluid drain from the affected area and into the nodes. Another option is surgery, but surgery should never be a simple way out. As with any surgeries, there is a risk such as nerve damage, blood clots, infection, further damage to the lymphatic system. Most people can manage their lymphedema with all the treatments mentioned, but if this does not respond, then surgery may help, such as liposuction, lymphatic reconstruction, and tissue transfer. Please talk to your GP. And medications. There is no proven drug to treat lymphedema. Diuretics are often used, but these are used when fluid is around the heart and lungs and does not work on the lymphatic system. So, every state in Australia has a lymphedema support group. Do not go through this alone. Go to your Australasian Lymphology Association to find a qualified specialist in your area. And watch out for my next short explanation on anything related to the mind, body, and soul and holistic nursing in Australia. Thanks everyone for watching from everyone at Mind, Body, Soul Nursing.